Hi, Dr. Gan from Dr. Vein Medical and Cosmetic. Today I'm going to be addressing a very common question that comes up, and it's probably a comment that pops up a lot when you're at dinner tables and when you talk about any treatment for varicose veins, and that is, will my varicose veins come back after I've had treatment? Now, the reason this pops up a lot is because in the past, if you had no idea about varicose veins and you just happen to be listening to this video, or you've come across someone who's had varicose veins, the passing statement that usually follows is, why bother having treatment because it all comes back anyways? Now, today I'm going to address this because there might be some truth to that comment, but more importantly, I think it's important to address that comment by itself because there are multiple factors here. And so the first and most important question you need to ask when you hear such a comment is, what type of treatment did you have? Now, in the past, the only way of treating varicose veins was by surgery, and specifically a type of surgery known as stripping. Here, the vein was basically pulled out after you've had general anesthetic, and it was pulled out from the inside out, and the chances of a new vein developing in that area where it was treated was very high. And what I mean by that is that in a year, in 2 years, in 5 years, there could be a high possibility that you develop more abnormal veins in that region which was treated. Now, in comparison with the newer treatments, and I'm specifically talking about endovenous laser ablations and to a certain degree radiofrequency ablations, the chances of any new vein development after it has been treated is close to 0%. That means that when you've had that vein treated, the chances of it coming back is almost negligent or nil. So we sort of guarantee that we're up to 99.8%, which is almost 100% sure that that treated vein will be gone once it has been treated. Now, an important point to remember is that sometimes you can get abnormal veins, or maybe I should put it this way, sometimes you can get veins that are normal currently. So if you've come in for an assessment and I've had a look at your veins and I've had a look at your veins under ultrasound, I usually mention to most of my patients that these are veins in this location, in this area, completely normal now. Now, in 3 years, in 5 years, in 10 years, if that vein becomes abnormal, then sometimes it can pop out on the skin and come across the area where you used to have a vein, and it can almost feel like that vein has reappeared. But if you've had the newer treatment, I can often guarantee that that vein that we're seeing pop up is a new vein. And with most of my patients, I usually show them their normal veins, and I usually tell them this vein is completely normal, and I show them the abnormal veins as well so that they know exactly which veins I'm actually treating. So in that way, they're crystal clear that the vein that has affected them, causing them the symptoms, causing them the signs that they see on their leg, are treated. Now, another important factor to note is that if you produce veins often, and you usually know which patients these are because you often get veins at a very early age, there could be a high chance that you can develop more veins as you get older. We tend to call them the vein makers because they keep making veins. We can always treat the veins and we can guarantee those veins are gone, but then there's a high likelihood you're going to create new veins. So coming back to the first comment about it's going to come back anyways, it's not completely true, especially for the new treatments, because when we treat these veins, we can guarantee they're gone. The last point I want to make is, if you've had a vein treated, for example, there's a vein on your leg that has annoyed you for the longest time and you've had it treated and you've gone through the entire procedure and you find that vein hasn't disappeared, or it has kind of gone down but it has popped up again in the same location, then there's a high likelihood that that vein wasn't treated in the first place. There could be multiple reasons why that's happened, and I've always told patients that if this happens to you, or if it's happened with me, I often want to be the first person to know about it so I can have a look at it. But more importantly, I think if you've had it treated with someone and it's come back, you may want to get a second opinion. And here at Dr. Vein, we're quite happy to have a look and let you know whether or not that vein has been treated. Important is that I actually make sure that I follow up every patient to ensure the vein that we've treated is gone. Because if I haven't done my job, I'm completely transparent with patients that it hasn't closed, and we may have to do a different form of treatment to close it because it may be a little bit resistant. But oftentimes the most important thing to ensure is to make sure that the vein that we're actually targeting and treating is treated. It gives you an idea of whether they come back or not, and more importantly, if you're having a dinner meeting with a whole bunch of friends, you can kind of tell them that it's not true. Varicose veins can get treated and they can be gone forever.